Now, let's take a closer look at the third step of the infection cycle, the portal of exit. This step is crucial in understanding how microorganisms leave their reservoir and move on to potentially infect others. It's not enough for a microorganism to simply live on or within a reservoir. It also needs a way to exit in order to infect someone else. This is where the portal of exit comes into play. For example, if a bacteria or virus is living inside Betty, it needs a way to leave her body before it can infect George. Understanding and controlling these exit points is a key step in preventing the spread of infections. Pathogens commonly exit their reservoir through body fluids. These can include blood, secretions, such as saliva and mucus, which are substances produced inside the body, and excretions, which are substances the body eliminates, like sweat, urine, and feces. These fluids provide the perfect vehicle for microorganisms to leave their host and potentially infect someone else. In humans, these body fluids can leave the body through various means, such as coughing, sneezing, talking, skin contact, sexual contact, as well as through vomit, feces, and saliva. Each of these pathways provides an opportunity for pathogens to exit the body and potentially spread to others. How can we stop the pathogen from exiting its host and reaching the next person? Let's revisit our example with Betty, our original patient. One effective method is isolation, separating her from individuals who are not sick. Isolation reduces the chance of the pathogen spreading through direct contact or shared environments. If the pathogen spreads through the respiratory tract, such as by coughing or sneezing, we can use masks as a barrier. By wearing an approved mask, Betty can still sneeze or cough, but the mask traps respiratory droplets, preventing the pathogen from traveling through the air to infect George. Masks are also crucial for healthcare providers and visitors to protect themselves and others. Another way to control portals of exit is by practicing proper hygiene. This includes covering sneezes and coughs with tissues or the elbow and immediately disposing of used tissues. Frequent hand washing is also essential to remove pathogens from the skin. For medical procedures, using sterile techniques is critical. Sterile technique involves specific protocols to keep tools and surfaces free from contamination. For example, during surgery or wound care, healthcare providers use sterilized instruments and gloves to ensure no pathogens are introduced or spread. By combining isolation, protective equipment, hygiene, and sterile practices, we can effectively block a pathogen's exit and help prevent the spread of infection.